I was reading your article that Quebec must add 500 million in mental health care, and I just wanted to speak to this with you. So I guess I want to understand a little bit more. Why do you think that there needs to be 500 million put into mental health care in Quebec?
First of all, it's surprising how come in Quebec and even in Canada, actually, we think about the health system as something very physical. We don't have we don't think as the mental health as a part of our health system. So the big part of the mental challenge or mental problem or mental a big part of healing mental challenge is coming from the private sector with the private insurance. And so what that does is that if you want to have a bigger help from the care system, you you should have a good insurance, or if not, have money. But what we see right now is that people that will uh, receive the most charge from the pandemic are in big part people that are we call them our guardian angel, are not people with big money or big possibility, and often don't have the possibility of a good insurance. So I think that's highlight a society problem that we already have in Quebec and in Canada. So my question is, how come, and how can we help? And Quebec has understand that there's a challenge, a problem. I think it's 5 years ago, uh, they invest 30 some million dollars to make sure that at least they have an estimation of 240,000 people, I think, to 2000, no, sorry, 200 and, sorry, 240,000 to 240,000 people. Yeah, 240,000 people that need at least a diagnostic and a somehow a checkup, and that costs around 30 million. But the reality, if for those checkup or those verification, it's often something like one or two time you see a psychotherapist. The reality, if you want to do something that help, it's need at least 10 or 12 discussion with a psychotherapist. So what we see is that the problem, what we do is not good enough. If we want to do something like have 10 or 12 discussion with a psychotherapist, we should invest around $300 million. And that would not be a big part of our health system. Like it's less than I think it's around. Let me check. It's around 0.15% of the healthcare system cost in Quebec, and there could be a lot of discussion between outcome. Canada will not help. It's not a big part of our system. But what we see is that other jurisdiction like Australia or United Kingdom are investing more to do that and going around 0.72% of their system. So we have place to grow. So first of all, second of all, COVID-19 will have effect on many people in our society. Nurse, professor, and even parents. Actually, what I saw a study from last September, and every people that already had some healthcare problem, mental health. Uh, uh, I'm sorry, I don't want to do the bad. I don't want to use a bad name in English, and maybe I'm not sure because in French, santé mentale is good, but I don't want to tell a word that could that could click something not good. Actually, that I just want to make sure. So if I say health issue, mental health issue is not, it's not a bad word. Is it
No, I don't
okay?
think so. We also use mental illness or
Well, yeah, okay,
maybe
okay,
difficulty with mental health. We
okay,
use as well. Yeah.
okay, okay. So yeah, so people that already have difficulty with mental illness as a preparation to augment those difficulty. Young parents of young children are getting more and more anxiety. First of all, they want to make sure that they got enough money for their children, but also because it's a bigger charge on them. We see that they augment their alcoholism, and so we can imagine that we will need more help to help those people. So what I suggest is to double that around to $300 million to around 5,050 or $600 million to make sure that the result of COVID-19 will not be carried along too much. And after that, I'm sure that we can use that money to continue to help the people and include a part of mental health in our mental system, in our health system, because clearly it's not integrated. And when we thought in the 50s or the 40s, when we thought about the health system, we could not imagine how the society would transform. Right now, there's not we don't have as much as, for example, uh, accident on the place of work that might need to be transferred to the hospital and be in charge by the states. But we do have more and more mental issues problem that are coming from the work. So, and it's not only it's statistical, but it's clear for, I think, a big part of society. So how can we address that? And I don't say that we have to use all the budget of the health system or raise the taxes to do that much. But we do have to question that system, and we do have to ask ourselves how the COVID-19 can show us maybe a part of a problem we didn't take too much seriously.
Thank you so much for explaining that. Sorry, this is just a little visual thing because it is for video. Is it possible to ask you to back up just the tiniest
Oh yeah,
bit?
maybe.
That's perfect. I'm so sorry about that. I know it's
No problem.
it's kind of difficult when you're talking, but I have to kind of visualize things for the
Me
video.
neither too.
That's perfect. That's absolutely
Okay.
perfect. Thank you so much for doing that. So in terms of being able to fund this, do you think that the Quebec government, they have enough money for this, or does there kind of need to be different ways that we need to fund this?
What the COVID-19 has shown us is that if the government want to use money to use money to patch things during a crisis, they can do it. And it's real for Quebec, it's real for every government on the planet right now. And we can easily use a budget for that after for the COVID-19 problematic. After that, Quebec could do the choice to manage differently part of the tax system and the imposition tax system to make sure that they can have some million, around or $600 million more in the healthcare system. They already did it. They can do it. It's not as big a problem. And also, every study that we read tell us that if we invest in care around mental illness, the society are more productive at work, can help the economy in another way, and the prevention on those problems are way more cheaper than the problem themselves after. For example, crisis or problem with suicidal thoughts and those kind of problem. Every study shows that the prevention is way cheaper than dealing with the problem after that. So I don't think I think it's a win-win situation if we want to invest in those cares.
Very well said. Absolutely. Thank you for sharing this. So something that I was also looking at outside of completely being government funded is something called a wealth tax, where essentially people with very large incomes, higher incomes, are taxed a bit more. And this tax is put into wellness services such as mental health care. Do you have any specific thoughts on this?
I don't know that specific system, but it could be a good idea. But I think the first thing we can do is, first of all, just make sure that we have an imposition system that taxes well the wealthiest of our society, and make sure that everybody can be assured at least a minimum to see a psychotherapist if they need so. I don't think it's too much to ask. I don't think it's impossible for our occidental society with a good wealth system, and let's face it, uh, a good economy in the circumstance, and a good public finance system. So, but before to do a specific tax on this, I would think the better thing to do is to make sure that we got to have a good imposition system, and make sure also that we think of that as a way to get out of some of that crisis. Helping people that will, if we were if we think about that, like if we think of that crisis as a form of maybe, for example, a post-traumatic crisis for the people in the health system mostly, but I think pretty much every and many parts of the society, if we don't want to be in the next 20 or 10 or 20 years with some big problem of anxiety, big problem of mental illness in the society, I think it's not only a taxation problem, but also an investment problem, the project, to make sure that everybody go well. And it's real for the adult, but also for the children right now, that they have a lot of pressure. We see that children, mostly young adults, or seems to have a bigger problem to dealing with the mental health. We want to make sure that they can be happy and work, not necessarily work, but be happy and be the better part of our society in the next 20 years.
Thank you. I just wanted to go back to what you were talking about earlier, when I had asked you about the 500 million. So you
Mhm,
mentioned these, typically 12 appointments with a
mhm,
psychotherapist. So when you envision, the government providing 500 million to mental health, would
mhm.
this include 12 sessions to every Quebecer, essentially?
No, no, actually, the what we got right now is around $66 million that are uh, the way the way it's calculated is about, we think, or the government think, that there's around 240 240,000 people that need help every year, pretty much. That's the calculation. So they pay 66 million for them to have one or two discussion with a psychotherapist, or have pro tips to how to help their healthcare, the mental health care. But what I envision is that, supposingly, that we double those 240,000 people, uh, at for a moment, at least for maybe 2, 3, 5 years, so dealing with the problem. That would mean 10 to 12 sessions for around 500,000 people. That could
Um,
be more, that could be less, but make sure that everybody that needs it could have at least uh, a small therapy.
Okay, thank you for explaining this. And is there anything else, within this 500 million that you envision, maybe specific things that the Quebec government isn't offering, or services that aren't maybe strong enough as they are right now?
Um, you know, as we saw yesterday, I think we know that people that have a mental problem right now, and don't have many service, and if, for example, they want to see their loved one, they have to do a quarantine of 14 days before and after. We also know that there's many people that are normally natural, des aidants naturels.
Um,
Uh,
could you,
the people, the natural are when, for example, you have when you're doing a bit of the nursing for a loved one, so that you're recognized as natural aid. I'm not sure. So so actually, what we see that those people that normally help people with mental issue problem cannot be with them. So it's causing a lot of pressure on them also because they don't know if, for example, their loved one are take well, have a, sorry, I'll start back. So what we see is that people that are institutionalized in mental care institution, or even in that could be in CHSLD also, that are hospitalized but cannot count on the help of family, uh, are have a lot of pressure on them, and that's why some people ask for them to be vaccinated more the quickest possible so they can be helped by family and loved one. But that's caused a tremendous amount of pressure for those people that have been pretty much 1 year off of the without seeing pretty much anybody. Um, the people that their loved one will have a pressure to be able to explaining why they didn't be there and how come they cannot be there. So there will be, I think, a problem on that part of the side, defense. And normally in the mental care problem, there often are the last to whom we think about. The people that suffering from those mental issues and the people that helping them. And I think we should think of how we can help them in the future. But I don't have any solution except that make sure that they can have at least afford some help. Uh, and it's real for the for those, but it's real also for the people that will have lost loved one without even being able to say them goodbye. And those guys, when the crisis will finish and the dusk will go down, there will be mental issue problem that we'll have to deal with.
I guess that kind of leads me to asking, do you, with how the government is operating and the mental health services that they're providing right now, do you have a fear for, when this crisis ends and a lot of people will be trying to confront mental illness and just deal with the emotions of the pandemic?
Yes, for sure. And a study published in, I think, last September by UBC show us that in all the people that need mental health that discussed about that, 22% of them didn't even know that there could be help. So that says a lot of how we see the mental health problem, and more. Also, I got another stats. Sorry. Uh, um, sorry. And 22% didn't know that exists, and 21% didn't think it could help. So we'd have a lot of education to do on how mental health, uh, what is mental health, first of all, and how could it be taking charge, how we can take charge of those situations. And we don't see it very much as a health problem right now. We have associated with a physical problem our healthcare system, but we do have to think about it otherwise. So so it's important to make sure that those things could be provided. And it's real for the Quebec. I think it's real for Canada also. I think there could be a big discussion, uh, a big part of the principle that found Canada is a healthcare system. This healthcare system has to be modernized. It's modernized when we have for example, the population that are older and older, so we change things. The reality of people that are working right now is that they have more mental problem, uh, possibly more mental illness, less physical illness. So let's maybe modernize that system.
Thank you. Yeah, it's very true that, there's a lot more awareness brought towards physical health, but really not the same as mental health, unfortunately. I'll try to speed it up because I know I've taken so much of your time. Thank you so much. I really appreciate that. But you mentioned about guardian angels, and I was just thinking about people who are kind of, I guess, undervalued in our society and maybe ignored, including these people as well as, homeless people. Do you feel like in our current system, a lot of these people don't have enough support in terms of mental health?
First of all, I'm not a specialist on those specific problem, and I'm pretty sure that every specialist will say we could use more budget. That's I'm sure about that, and I think that we don't value the people that every day of their life trying to help people with mental health issue or with the problem with homeless people, and I think it should be said, uh, and I think that probably I don't think I'm pretty sure actually that every dollars that we put on those problems have a higher value than dollars that we put on other different problems. For example, and we should ask ourselves how come we don't have any problem to subvention big corporate sometimes to make sure, or asking ourselves if, for example, GNL Quebec should be helped by the states, and don't think of ourselves of how come we don't put the 10 or 20 millions more on some issues. So we have to ask those questions, and that's important. And we have to ask our question. We have to ask the question. We always say every budget. We say, oh, the health system take a big part of the tax of Quebecers. Yeah, that's right. But it's also education and health system are pretty much the biggest the biggest fees in every other jurisdiction if we don't go there, and it's normal that we use it. After that, we can make sure that we have a system that is public and more efficient on those cars. And if people want to do more more of that, they can also go with the private sector. But the reality is that the people that probably will need most more security, the people that are facing the most possibility problem with mental illness are those that have question about their economic health and about and about their jobs, and they have jobs that are often very tough, and so they need to be helped also, and they need to know that help exists. And right now we don't even have that step in.
Thank you. I remember reading in your report that you said because something along the lines of, because we're not putting enough funding in mental health care, it's eventually kind of draining our system in terms of other resources, maybe physical health care. Is this something you could maybe touch on a little bit more?
But actually, here what I check, it's funny because when we check about mental health, every sector of our society are saying we should help people. Private, normally we do have a part of the private sector that say we should not pay too much money because taxes are for there. We can have insurance, but the reality is that even for the private sector, they understand that if we invest in mental health, they will have to pay less insurance at the end of the day. That's what we're gonna have, and they will have. I don't like the term, but they will have employees with more productivity because they are in better shape. So yes, and so they say every time we do prevention, we help ourselves to be more productive. For example, they say every dollars that we invest in prevention is bringing back $1.62. I cannot make sure that the validity of that kind of methodology, but it's explaining us the thinking behind. So And after that, when we do have problem with mental health, it's often going to make push on other physical problem more important after that for different reasons. They could be accident, it could be people with suicidal thoughts, it could be more alcoholism, more drugs. There's plenty of things that might come back with that. So in the same way, prevention here is the key to make sure that it's better for every people, but for the society. And prevention is often not that much. It's often 10 or 12 discussion with a psychotherapist. It's not always that. It could be more, but for the vast majority of people that will need that help, this will help a lot.
Thank you so much. Thank you for explaining that. Is there anything that I didn't ask that you think is important for me to know?
No, but I think we can lay out that there's some jurisdiction that are doing more, United Kingdom and Australia, but I think we should say that it's coming to be the more and more. It's a question that is coming back more and more because right now, for example, not every jurisdiction that have a healthcare system, and they do have a private healthcare system actually. So, so and the other thing is that we should be careful also that help is in psychotherapy session and not only in medication. So there's also a big part of our healthcare system right now that front on, on the healthcare system, the big spending are on the doctors and on medication, pretty much. And it's a way that we found to be more productive. It's maybe not the only thing we could do with the mental illness, and we should ask ourselves how to make. So I think the best thing to do is to take that question and maybe, for instance, invest right now to make sure that people can have the help, but maybe rethink and modernize our care system to make sure that we integrate the mental issue problem. And I'm probably not the better person to do that exercise, but I think that the exercise should be done.